Hello, I'm Travis Suit.
Hi, I'm Piper Ackles.
Hi, I'm Nikki Suit-Stelgis.
And I'm LeeAnn Suit.
And we are one big happy CF family.
So we're a family of 4 siblings, and I have an older brother, Jeff Suit. He's not here. And I'm next, LeeAnn, and Nikki is my baby sister, and my baby brother Travis, and my niece Piper.
And I'm Piper's dad. And so LeeAnn and Jeff were from my dad's first marriage. Nikki and I were from the second marriage. And so we have 2 different genetic variations from those moms, but we share the same patriarchal father and her grandfather. Cystic fibrosis is a progressive genetic disease that mostly affects the respiratory and digestive system, and it's caused by a defective protein and carried through genes from both parents for a child to have CF. And it causes a lot of complications because the defective protein overproduces essentially mucus inside the body. And when you have an overproduction of mucus inside the body, it's like having too much oil running in the engine of a car, or if you left a hose on in the grass and it floods the grass. It presents a lot of challenges. And in the digestive system, it creates a lot of blockages and issues there. In the organs, in the lungs, it's an open airway, so bad bugs, viruses, bacteria going in, they harbor. It's a sticky, wet, moist environment like a petri dish, and it creates a lot of havoc. It wreaks havoc inside the lungs. So it's not an easy disease to understand. It's complicated. It affects everybody differently. There's over 1,500 different genetic variations, and they're discovering more every single day. And so I would invite anybody out there to really investigate why CF is, it's challenging to understand, but if you do talk to somebody with CF, you can ask them questions and they can really give you a great understanding. And just to have the flexibility and the intellectual capacity to understand that, and to deepen in the compassion that everybody's journey with CF is different. And so, one person with CF doesn't look like another person. CF is often an invisible disease. Most people watching this video and looking at the 4 of us would never know that we all have cystic fibrosis, and what Piper and LeeAnn have been through and the tremendous hardships and challenges that they've had.
Cystic fibrosis is it's a disease that is progressing every day as we're living and aging, which is a natural process, but what is on the inside is not what you see on the outside, and it's very deceiving. Mm-hmm. So I was diagnosed in November of 2010 with Delta 508 and D1152H, which is a milder gene of cystic fibrosis.
I was diagnosed in November 2011 with 2 copies of Delta 508.
I was diagnosed in November 2012 with 1 copy of the Delta F508 and 1 of S1235R.
And I was diagnosed in November 2021 with the Delta 508 and S1235R.
As a young child, I lived a pretty normal life. As a young teenager, I was smaller than most kids my age, and probably in my teenage years began to cough and vomit mucus and show symptoms of what I believe to be allergies, like from our rabbit or our cat, or just common things that most people would deal with and just not be suspicious of anything serious. And that escalated through my teenage years, through some pregnancies, and my lungs continued to deteriorate. I stayed thin and had a pretty productive cough for a long time, some digestive issues, and so I was undiagnosed until 2010.
Piper's early symptoms were that she had a really heavy productive cough. a lot of mucus and congestion. She had a hard time breathing out of her nose, and eventually, after repetitive lung infections, she developed pneumonia, and she was diagnosed when she was 4.
When I was born, I was 6 weeks early, and at the time, my lung collapsed, and I was taken to the hospital. And at the time, they felt like it was just because I was early. But now that I've read about it, I know that having a disease like CF can cause your lung to collapse more easily. So I was in the NICU for 12 days. That was kind of possibly the first early sign of CF. And then as a child, my mom mentioned that I had a cough on and off, but she actually took me to the doctor thinking maybe I had something like whooping cough, and that was ruled out, and then they kind of just attributed it possibly to allergies. But over that time, growing up, I really didn't have many concerns with my lungs, so it wasn't until I was older and my first pregnancy with my child, I was tested the exact same week that I found out LeeAnn was diagnosed. I was given a phone call about being a carrier. So I was told I had the Delta F508. I had just learned about LeeAnn's diagnosis, and I had my son. And then after that time period, I felt like I had some additional signs or concerns that led me to do testing. So I had, a sickness that lasted for quite a long time that I treated several times with antibiotics that wasn't going away. So I just looked into, treating that. And when I did, I had a spell of a few days that I was coughing up blood, and it scared me, thinking, there was something maybe more there. So that's when I was diagnosed, as I pursued the testing with a sweat chloride test, and it came back positive in November 2012.
And my early symptoms, now reflecting back, were when I was a child. I was definitely known in the family as a very gaseous child. I had a lot of bloating, and that's a big sign of having digestive issues with CF. And I just thought that was normal. And it carried on and persisted and got worse into my 20s. In my 20s, I was dating a girl, and at one point she said, "Hey, you cough and spit a lot." And I had never noticed it, and it did progressively get worse in my 20s. But I was very athletic, and I had a really healthy, strong upbringing, so I didn't really have that many severe symptoms. I was hospitalized once. I thought I had an appendicitis, and it ended up just being gas. And I also had one experience with a lung infection that turned into bronchitis. And at that time, the doctor said, well, this is kind of unusual for somebody as healthy as you. But I never really looked into it further until LeeAnn was diagnosed, and then Piper was diagnosed, and eventually Nikki was diagnosed as well. And my symptoms were always light. So I waited a long time to get to go get tested, but the symptoms have progressed, and so eventually I did get tested, and I got the sweat chloride and the genetic test done, knowing that Nikki had already tested positive with the 2 genes that I would have. So it was easy to look for and identify those, and that's what turned up. So I was diagnosed in November 2021.
So some of the hardships I experienced with cystic fibrosis, early on before my diagnosis, I was chronically ill. Cough, 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 and vomit mucus, headaches. I was thinner than normal, didn't process and digest food normally. I saw a physician. I had chronic pneumonia. I did have 2 children early on in life, and I had some issues through the pregnancies. During one of my pregnancies, I was sick, and one of my OB doctor took a chest x-ray and expressed some concerns about my lung condition. At that time, I dismissed it. It was kind of the norm for me to cough, 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 and I did start seeing a physician for some chronic pneumonia. My lungs hurt, my abdomen hurt from coughing excessively. I was diagnosed at that time with postnasal drip, and for a really long time I intermittently took antibiotics for several years. And this one particular year, after being treated for about 2 or 3 years with postnasal drip, I was exhausted, coughing chronically, and sick all the time. I had gone for an appointment and gone back to work, and I had a coworker that I work with that had a wife that had a double lung transplant, and she had a physician in Port St. Lucie that he said to me, "LeeAnn, you don't look well, are you okay?" And I said, "I'm just exhausted. I cough all the time." And he said, "Let me reach out to my wife's physician and see if he will give you a consult." I went to see this physician, and he did a chest x-ray and called me immediately and said, "You need to go for a CAT scan." And I said, "Oh, well, okay, I'll go for a CAT scan." So I went for the CAT scan. He called me back immediately and said, "You need to come to the office." And I went in to see him, and he said, "I think I know what you have, but I don't treat patients with this type of issue. You have severe bronchiectasis, and your lungs are in terrible shape." And I said, "Well, what do we need to do?" And he said, "You need to go to the Mayo Clinic." I got up to the Mayo Clinic, and we did what's called a sweat chloride, which is something that all of us have done. That sweat chloride was negative, which meant I did not have cystic fibrosis. So we knew that I had advanced lung disease because I had not been treated properly for the illnesses that I had. So we started immediately with really aggressive antibiotic therapies. Year after year after year, 18 months of very heavy doses of antibiotics for several years. And my symptoms lessened, but they never went away. So after several years of treating, we did some biopsies of my lungs, and we took some samples of the mucus, and we checked all these things, and I was growing lots of bacteria that just did not make sense to the physicians at the Mayo Clinic. So several years into those treatments, when they were no longer effective, I had a lobectomy. I had my left lung sectioned. So I went in to have that procedure done. I was a little bit disappointed and scared, of course, about having the procedure done, but we had exhausted all the other treatments that we could do at that point. So that was in 2001. I had my left lung sectioned. I spent about 9 days in the hospital in a monitored care unit, and we took out all the bad airways and all the necrotic tissue to hopefully preserve my left lung and help my right lung so that those bacteria didn't go over into the right lung. So I did pretty well, I'd say, for that year and the next year. It was a tough procedure. It came with lots of challenges, some reoccurring lung bleeds. Again, my weight was down. I was 80 or 90 pounds, 90 at the highest, and I really still didn't know why my lungs were in this condition. So I got to Shands in Gainesville with a pulmonary physician there, and started just treatment for just advanced lung disease, and that's how I was treated. The antibiotic therapies were no longer effective, and the bugs in my lungs were taking over. They were wreaking a lot of havoc. These bacteria are very slow-growing microbacteria, and they eat the lining of your lungs. It takes them a long time, but they do a lot of damage. So this particular year, I was going to be flown to the Jewish hospital in Colorado to have my left lung removed because this lung was not functioning well. I'd have a bleed from that lung frequently, and still, the antibiotic therapies were no longer effective. There was a young intern there that I saw that was doing her residency, and she came in and she sat down with me, and she said to the physician who had been treating me for a couple of years, who was amazing, I absolutely loved him, she said, you know, they have a new DNA testing for cystic fibrosis. It's a genetic testing. She said, I know her sweat chloride's negative, but what do we have to lose? Why don't we do this genetic testing? And that physician said, well, I bet everything I own on it she doesn't have cystic fibrosis, but if she wants to do it, we'll do it. So I agreed to do it, and she was right. They called me and said it was going to be, you know, $800 for the test. Did I want to proceed? And I agreed to do it. And so we did the blood test at Shands in Gainesville in the pulmonary department, and it took about 6 weeks. And she called me herself, and she said, LeeAnn, can you come and see us? And I said, yeah. And I asked her, I said, well, what did it say? What did it say? She says, you just need to come and see us. So she said, when can you be here? And, you know, I had a lot of anxiety, you know, I just wanted to know, you know, did I have CF or not? So it's a 3-hour ride from my house to Gainesville, and I took the trip up in like within 24 hours. And I sat down with this physician who'd been treating me for a long time that was just getting ready to send me for a left lung removal. And I had a positive diagnosis of cystic fibrosis. And for the first time in my life, I was relieved to know that this is why I was so sick. And I didn't know much about cystic fibrosis. I say I was relieved because at least I felt like there was an explanation for why. And I just got behind it. And of course I transitioned. I no longer saw that pulmonary physician anymore. I went straight to a CF team, a clinic care team of cystic fibrosis physicians. And I'm 53 now, and I'm a geriatric CF patient. And I'm aging and advancing with cystic fibrosis in ways that they haven't seen in years past. Technology and Trikafta and lots of things that are helping me thrive and survive cystic fibrosis to this point.
So some of the hard things I've had to deal with CF is being in the hospital for long periods of time, and I was really underweight and I had to get a feeding tube and doing breathing treatments every day and taking lots of pills day and night and having to eat eat more than normal kids to maintain my weight, and having lung infection.
This was my idea to do the video, so I'm the one responsible for making, you know, her cry. You guys can all blame me.
Having lung infections and being like really tired doing normal daily stuff, and just having to like take the time out of like my day when I'm doing like things that other normal kids do, and having to remember that I do have cystic fibrosis and having to do my treatments and my pills. And yeah.
Crying, I think, is one of the most beautiful expressions of humanity that we get to share and witness and to be present with each other when we share in something so vulnerable and connect in that way. So it's beautiful.
I wasn't sure really even the best way to talk about this, but I think based on, you know, the conversation we're having, I think one of the hardest things for me is honestly like feeling like it's not even fair that I don't have all of so much of the challenges that you guys go through, because I'm sitting here with you, and I wish that none of this suffering that has come with it, you know, ever happened. You know, I'm grateful for all the things that we've gone through together and that we've learned and that we've, you know, been able to experience being a family with this. But at the same time,
it's not easy. So I was diagnosed because I knew that LeeAnn was diagnosed, and then Piper was diagnosed. I honestly don't know if I would have ever known if it hadn't unfolded this way. But the symptoms that I go through, you know, are mostly more digestive, a lot of digestive issues, which are embarrassing to talk about, but it's something you deal with. And, you know, as far as my lungs, it's more of an unknown. You know, I honestly even haven't had CAT scan or testing to know what my lungs look like, but I know that in the time periods that I've gone through sickness, it is harder, you know, it's hard to get better, but I honestly just don't know. You know, it's a lot of unknown for me. So when I found out, you know, through the pregnancy that I was a carrier, and you know, the chance of my child having it, that was a tough time, you know, just because we were learning about it, and I didn't know if my husband was a carrier, because that was something that, you know, a lot of times when you're aware of CF in your family, you would find that out. So I was already pregnant with my son, and I found it out, you know, along the way. So we did genetic testing for him to find out if he was a carrier, and at the time, you know, I was having also similar, like, maybe it was allergies, maybe it was something else, you know, it was just unsure. But going through the testing process and finding all that out, you know, it did give me the ability to start talking to doctors. LeeAnn actually said, because I was in Orlando and I knew I was the carrier of the one gene, I went and did the sweat chloride testing and was diagnosed with the positive sweat testing, but the clinic that I started with in Orlando wasn't able to find the second gene. So they did genetic testing, but back then when it was first started, it was hard to find a second identifiable gene. So I had already been diagnosed based on the sweat test, but not the genetic test. But LeeAnn suggested that I go to her doctor at Shands, and I'm thankful that I did that, because the entire course of my treatment was changed when I went to Shands. So the first doctor actually started saying, start doing all the treatments every day, start, you know, taking these, you know, the enzymes and things like that. But he put me on a regimen as if I had been diagnosed as a child, you know, and not as a 30-year-old person that had gone for 30 years without those medications. So when I went to Shands, they were able to explain it better as far as for me personally what I should do, and they were able to identify the second gene.
The hardships that I've experienced with cystic fibrosis are very different than what has been shared by my sisters and by Piper, and it's been a process over the years since LeeAnn was diagnosed and Piper was diagnosed very close after, and then Nikki. And the biggest difficult experience was bearing witness to Piper's diagnosis and being her father, and and everything that comes with that, all the unknowns, the fear, the heartbreak, and I didn't really understand when LeeAnn was diagnosed, because I didn't understand her condition. I didn't understand what she had been through. I didn't know much about her health journey. So I was even in denial. I remember when I heard that LeeAnn had been diagnosed with something and that they had kind of found out what was wrong, I was like, oh, wow. Well, that's good that they finally figured it out, but I didn't have a connection to it in a lot of ways, except for my connection to her, and I didn't understand it like many people don't understand CF. And then so when Piper was going through her process and was getting sick, and I remember LeeAnn suggesting, you know, what her symptoms are sound really similar to cystic fibrosis. And I remember thinking in my head, it's not the same thing. There's no way that what Piper is experiencing has anything to do with what LeeAnn has. And man, was I wrong, you know, but I didn't know that I didn't understand it as a genetic disease. So, you know, when Piper's diagnosis came, I mean, it hit like a bomb going off, emotionally, psychologically, and for me, it really put me into a place in my life that brought me to a crossroads of really trying to find meaning in what I was doing with my life, because all I could think about was her. And so I would say that's the biggest challenge and hardship that I faced personally. But then over the years, you know, after Nikki was diagnosed and I realized the possibility that, you know, that I may have CF, it very quickly dawned on me that, you know, the work that we had been doing and my commitment to wanting to help in the CF community, to pouring my energy and passion into advocating, into fundraising, and into what had become something that I was really enjoying doing with my time and energy, which was trying to make a difference. It became clear to me that, oh man, you know, well, if I got tested and had CF, you know, I wouldn't get to be around many of the people that I have come to love so dearly, and I wouldn't be able to go to the hospital and bring care packs or to have this relationship. And that really scared me because, you know, in my head, I knew that I wasn't a threat because I was very healthy, you know, but I didn't know if maybe it was a threat to me and my health, but I wasn't really sure. And my symptoms were light, so I wasn't confident that it was the best thing to do. And so I waited a long time to get tested. But I would say the second part of that is the mental aspect of not knowing. And I didn't realize how psychologically not knowing something can wear on you, and how, you know, over time, just not knowing the truth and not honoring my truth. And that's a big part of why we're here, is this is our truth as a family. This is us being transparent. This is us honoring the path that we've had, which is complicated and strange and confusing and scary. And so it just felt like, if I, you know, and LeeAnn and Nikki had mentioned, you know, if you look at our path and story, a big part of this is that we didn't know. LeeAnn didn't know, Nikki didn't know, we didn't know until Piper was 4. And there's possibly hundreds, if not thousands of people out there that could be living with cystic fibrosis with mild, moderate, or severe symptoms even, who don't know. And it's really important that we share, because maybe this story and our story can help to engage curiosity and inspire somebody who might be going through these same hardships and find value in taking a closer look or you know, examining it a little further.
For me, living with cystic fibrosis, I shifted gears tremendously upon my diagnosis. Every decision that I made from that point going forward was based on longevity. Would the decision that I make from what I would choose to eat, whether I would pull myself out of bed and exercise, you know, mentally, emotionally, physically, financially, and spiritually, longevity was important. And I chose to look at my cystic fibrosis as the greatest gift I would receive. It would force me to live so differently than my peers. The value of my health became the greatest asset I had to live with. And I had already had my lung sectioned, which had we had a CF diagnosis, we would have preserved that lung. So I had some challenges and I shifted gears. When my niece got diagnosed, And I was in clinic, and several opportunities came up to participate in clinical trials. And these clinical trials were appointments every 4 weeks, blood draws, breathing tests, lung functions. They were aggressive and oftentimes came with some risk. But when I thought about Piper, and I thought about her longevity, and I thought about what she was going to face, and I reflected on what I had already lived through, and it was tough for me. I loved her so much, and it wasn't just her. It was every baby that was going to be born, that hadn't been born yet, that was going to face the need for a therapy and the need for advancements. And, you know, I had 2 children, and they were young adult children I had to think about, and my boys often said, you know, they're using you as a guinea pig, like, why would you do that? And I felt as though it's necessary for us to have clinical trials on humans to find advancements to bring longevity to CF patients. And every single clinical trial that came up that I qualified for, I took that 3-hour drive up and that 3-hour drive home, and I prayed, and I just hope that these physicians and these scientists and these people that put in this effort to find therapies and advancements and look at all these things, and as a geriatric CF patient and as aging, you know, I felt like I had nothing to lose. And what if it helped me? What if I gained something from it that was beneficial? I never chose to look at the negative impact of what the outcome could be, but only the positive impact of what could come. Not just for myself, but for so many others. And there were a lot of things that I had learned and a lot of things that I had journeyed through that, like Travis said, you know, Piper has a young brain, and she hasn't lived like I have lived and had children and had all these experiences. And the real raw truth about cystic fibrosis is there's lots of kids that don't make it. They don't make it to have any children. They don't make it even, you know, 5. There are children that die without any real explanation. You know, they don't thrive. They don't live as well. And it's a tough subject, and it's hard. And I can see the challenges that Piper faces as a young adult. You know, how many times we said, Piper, you have to eat more food, you have to eat more food. And as a young person, you know, when you're not hungry and you don't feel well, and I could relate to all the symptoms. And sometimes I would say to Travis, you know, not just as my baby brother, but as her dad, you know, I can relate to how she feels. And increase in weight is increase in lung function. It's increase in oxygenation to your organs, and it's a lot of things. It prevents the headaches, which you had reoccurring headaches, and you know, lots of problems that come that we often don't verbalize. We just don't talk about, and you certainly don't talk to your peers. And you know, even when I had my first lung surgery, I didn't tell my father I was having a lobectomy. I went up to St. Luke's to have a lung surgery and sat the night before, and the physician said, you know, okay, you know, have you told your family, are they coming? And I said, no. And the surgeon said, you're going to go call your father right now and your mother, and you're going to tell them you're having this surgery. I kept a lot of things private. I didn't want to burden people. I didn't share a lot of the hardships that I lived through. And sometimes I felt like, you know, if I verbalize this, you know, not that it's a sign of weakness or it gives life to it but it was difficult. It was difficult to share some of the things, and incredibly embarrassing. You know, I drank, my coworkers and my peers will tell you that, you know, I drank excessive amounts of piping hot tea to thin the mucus because I cough mucus, and it would sound like I was snorkeling in mucus. Not only was it disgusting, but it was embarrassing. And I couldn't get through a conversation without bringing up mucus. And it's gross. And as a female, you know, there's nothing attractive about that. So, you know, there's a lot of things that you deal with as a young person, or any person for that matter. And now, you know, we're living in times with COVID and respiratory illnesses, and we're professional social distancers and mask wear. We've been doing this for a long time, and it works. And there's no shame in putting on a mask and protecting yourself. You know, that's something we've done for a long time. And even my physician at Shands would say to me, you can't be with your niece, you can't have Thanksgiving, you can't have Christmas. And I do know a few cystic fibrosis brothers that haven't seen each other in decades. One has been transplanted and one has since passed away, but they spent 10 years not sharing family time. Now I have another clinic team person that says, you only live once, and this is your family, and these are your people. And lean into one another and love one another and be present, because that's what we're here for now. So, you know, lots of hardships and lots of journeys, and you know, lots of uphill climbs and challenges have come. But I could not imagine. We all have each other. All of us have one another. And that is the greatest gift, the love and the bond and the relationship. Now, Piper and I, you know, she lives a little bit north of me, and I love to drive with her in my car and bring her home, and I can imagine the good times we would have in the conversations. We don't share that family time because it's a risk for her and it's a risk for me because of the bacteria I have and the bacteria she has. So we can't live a sort of normal existence that most families can. You know, we're not going to eat or drink, you know, in close proximity. You know, there's a lot of challenges that we face as a family, but we work through. We get through it. And I hope to be a good support for her, and hopefully she can lean into me and Nikki and Travis as we journey with cystic fibrosis. We can all become closer in conversations with our differences, and also mentally the things that we're facing, you know. So living with cystic fibrosis, while it's unique to each one of us as individuals, and while it's different, it's complex, it has some similarities, and the bond is deepened by the relationship we have now of knowing that we all have these genes and we share this in our family. So it's a unique family affair, and we talk about the children, you know, my nephews and my niece, and about their children and their future, and when they get married and when they have kids, and you know, how we face those things now. You know, when my niece Kayla decides to have a family of her own, you know, knowing what her gene types are and knowing what, you know, risks that she might take in the partner that she has. So, you know, raising awareness and deepening the education and understanding is strength. It's strength in one another.
Living with cystic fibrosis at this point for me is really dynamic in a lot of ways because of the role I have as an executive director of a nonprofit that supports families with cystic fibrosis. One thing that LeeAnn shared with me early on that I began to realize as this journey of CF, you know, before I was diagnosed, was how often we lose people in the CF community, and how often, you know, as a community, you see others posting and sharing online and you're connecting with them in different ways, and how often we've had friends that we've developed relationships with that have passed on. And it's the hard truth of cystic fibrosis is that there are a lot of landmines in the health journey of those with CF, and that's the reality of it. And that's what one of the biggest things with living with CF is, that you're living with a diagnosis, you know, that your life is cradled by your death, by this terminal diagnosis. And so that's one aspect that I think has become abundantly clear, you know, over the years, and really a challenge to process and to cope with is loss and grief. and it's a big theme in the CF community. Another aspect of living with cystic fibrosis, for me at this stage is understanding how to relate that I have CF, but I don't really have that, many symptoms, and communicating that to others and trying to understand how that plays into things is new and an interesting aspect of it. And living with cystic fibrosis, there's a lot of positives. There's a lot of really beautiful, empowering experiences that you get to have with our family, but with other CF families and people out there who are going through these challenges and hardships. And it has taught me so much about living life. It's taught me, right, how to show up for people when they need you most. It's taught me how to treat our time as something that really is precious. And it's really instilled a lot of wisdom, this journey with CF. And so I really am grateful in so many ways. And like Nikki said, it's interesting to think that any one of us sitting here, just based on our genetic variation or the environment that we were raised in, might not be here right now. That, even at Piper's age, there's young people with CF still dying, and that she could not be here right now. And that we're so fortunate and grateful just to be sitting here, and just based on our we have 3 different genetic variations right here, and we all have different versions. And so those are some of the aspects that I've seen that have really been a big part of the journey.
I'd like to touch on something that's so important to the crossing. So we do a paddle out ceremony, and we take a rose, and we honor those people who aren't with us. And one year in Bimini, my dad would come over, and we would take care of Piper, and we would just assist doing whatever needed to be done. And the rose ceremony, we would compile a list of cystic fibrosis patients, and that list would be a running list. And oftentimes, it would be a screenshot of a friend or, somebody that we knew with cystic fibrosis. And the rose ceremony is a very special, sacred honoring of cystic fibrosis patients. And it's beautiful. It is absolutely beautiful. And I stood on the beach with my dad during a rose ceremony. We didn't have boards. We were handing out roses. And my father is a remarkable man and the monarch of our family. He's just an incredible, loving strength. And he's just given us so much that it's just hard to articulate. And my father looked down at the sand and these roses, and Travis was out on his board, and he was on the microphone honoring these patients. And my dad bowed his head and said, someday, he said, I probably won't be alive to see it, but someday he's gonna throw a rose for you and Piper. And the impact of seeing my father, acknowledge the raw realness of what we face as a cystic fibrosis family with these genetic mutations and advanced cystic fibrosis. This is real. This is what it is. And on the back side of that, there were mothers in that ceremony that had, we have family and friends and bonds and relationships that all participate. And what we gain from that is strength and love and support. And this community of cystic fibrosis people come together. And in the end, the strength of love is all you're going to need. And this cystic fibrosis community of people come together in a powerhouse of love and strength and support that carry our community of cystic fibrosis families and friends through this journey. And that impacts me every day. When I see the faces, and there's, we've got family here right now, you know, paddlers that show up over and over and over again. The value and the richness of the cystic fibrosis diagnosis and community is the greatest, most wonderful thing you can experience in a walk of life with cystic fibrosis. What Travis has created for cystic fibrosis families and for patients sustains us. This is what sustains us.
Exactly what you said. Our family, our grandparents, our parents, you know, they instilled so much love and the ability to support one another and having each other, having siblings, and just being there for each other, you know, is like the biggest part of living with CF. Is we're attempting to do this together, and you guys have been through so much, and you inspire me to want to teach my children, you know, my mom and dad, and all of the love that our whole family gives to each other. That's what I want to teach my children, is, you know, that's how I want to live my life, is to show them the same love and to show them that it's really important to be that loving, kind, supportive person to not only the people that you love and the family that you have, but also, you know, the extended family that you were just talking about with the crossing and with Piper's Angels. You know, it's something we never would have had in our life if it weren't for, you know, any of this. And then honestly, you know, there's a lot of people that would never have taken this type of disease and attempted even to do anything positive with it, you know, and I think it's absolutely incredible and amazing that you took something so hard, you know, and turned it into one of the most beautiful and positive and uplifting and like special things I've ever seen in my life. Like, it's incredible to me to even share with friends that aren't part of the CF community. They can't even understand it. Like, I try to explain it and they don't understand it, you know, but then they show up at the landing, you know, and they say, you know what, I'm going to come see this. And it's such an amazing gift to be able to like experience that. And I just hope for Piper and Garrett and Trevor and Kayla and Hawkins and, you know, all of our family that, you know, they feel and you feel this love is for you, and it's for you, and it's for, you know, it's for every person that joins in, you know, and every family that does have CF that becomes a part of it. I mean, it's incredible to see the connections that you guys have. It's just truly, I mean, it's a miracle, really, that you did all this, because it changed our life.
And the lives of a lot of people.
Yeah, a lot of people. For me personally, living with CF is a little confusing, like you talked about, you know, it's confusing to not know the best way to you know, go through treatment or what to do, and different doctors say different things, you know. I've had doctors tell me to go on the drug, you know, that you guys are on, because I might be better off for it 10 years from now. She said to me, you know, if I could take Nikki 10 years from now not on this drug, and if I could take Nikki 10 years from now on the drug, I would probably say you'd be better off on it. But she doesn't know, so that's hard for me. I don't know what to do either, you know, and I struggle with that. I struggle with the unknown, you know. When I first was diagnosed, I thought, okay, my life expectancy was just what? Was it cut in half? Was it, you know, I don't know. You know, you think about those things. But now I'm learning more that it's just everybody's different. Every single person is different living with CF, and my 3 kids, they need to understand it, and you know, it's not something to be scared of. It's just something to try to understand and do everything we can to make sure that we all have the best life possible.
Living with CF is what inspired me to want to help more. You know, seeing Piper go through long-term hospitalizations, challenges. I've told this story many times. Piper was laying in the hospital bed and sleeping, and I was on the cot next to her, and it was midnight, and she sat up and she woke up and she, you know, looked really scared, and she had tears in her eyes, and she said, "Daddy, my lungs are burning." And I called the nurse, and the nurse came in, and you know, the nurse gave her some painkillers to help ease the pain, and she fell back asleep. And I just went out in the hallway, and I realized I don't know what it feels like to have my lungs burning. And I literally, you know, collapsed against the wall and slid down to the ground in just a big puddle of tears, and I was an emotional wreck. And it was really that moment that really was, you know, in a way like an ego death, because up until that point, you know, I had a hard time communicating with people, and even at the fundraising events asking for money, right? And I realized right then and there, I will never, ever have a problem asking to support these families, asking for help for Piper, asking, because they need it. It's worth it. And when you see what these families, sometimes single moms with children with cystic fibrosis, you know, and what these families go through day in and day out, yes, we need hope for a cure. Always will. But we also need hope for today. And when you help people live longer, you have to help them live stronger. And that became evidently clear in the landscape, in the environment of CF, as to what the community needs are. And there are a lot of grassroots organizations that support cystic fibrosis, and they're out there, and they're doing what we do with Piper's Angels Foundation. And it's important. It's really important.
What inspires me most about the CF community is resiliency. What I've seen and inspired by LeeAnn and Piper and the people that I've gotten to know that have CF is the absolute ability to face the difficulties that they have and come out wiser and stronger. For me, the legacy of Piper's Angels Foundation, as simple as it sounds, is love. It's love. It's love among the entire community and group of people that show up and participate in the events, and they raise money, and they're near and they're far, and they all give love to everything that's being done, and that is incredible to me.
The legacy of Piper's Angels Foundation for me is unconditional love, absolutely. It's taking a situation, a challenging, difficult, heartbreaking situation, and looking for the ways to make it positive and to take a difficult situation and draw the nectar out of it. What is the wisdom? Because we all go through really difficult, challenging hardships in our life. That's the human path. That's why I believe we're here. We're here at the Earth School to learn. And when we go through these hard times, how do we extract what we're learning and then share it with others so they can feel it, so they can be inspired? And so that legacy of Piper's Angels Foundation is one of being present and bold in the face of fear with the adversity that we have, and expressing that resiliency, and knowing that life is short, and it's shorter for some than others. So you've got to make the most of it.
So cystic fibrosis is a genetic progressive disease, and I'm in what we would call, in clinic terms, end-stage CF wasting. And I absolutely do not like that. And I do not like to be called a geriatric CF patient, even though I know that it's just a term or a label they use in clinic. Get that out of my head really quickly. But one thing I want to express, and this is my only opportunity to do this, is gratitude. I live with the deepest of gratitude for my life and for the lives of others that show up for us, perfect strangers that have no relationship to a patient or a family with cystic fibrosis, have fallen in love with us and our family and our connection to the ocean and to paddling. And it is impossible for me to be able to express this deep, profound gratitude. The love, the relationships, and the people are incredible. I mean, absolutely incredible. And to have had the honor to have these people present in our Piper's Angels Foundation, the forefront of the story has always been Piper. The powerhouse of what the foundation does is for an entire community of families with children and parents. We're supporting families in ways that are just, they're big. They're big. It's financial impacts. It's supports of ways for them to get out and stay active. You know, the financial support, the impact of the community support, the love, it's showing up. And just like they show up for us, they show up for everybody. It is just gratitude, the deepest of gratitude. And if the world could just experience the love on that beach, the love on the landing, the power behind the strength of love and support that is shared, you would need nothing else in your life but that. That is all you need. And it sustains us over and over and over again. The legacy of this foundation will live forever in every wave and every ripple of energy that will live forever in cystic fibrosis families and communities. The content of what we do and what we share is going to live forever. And we can't do it without you. There's lots of babies that are going to be born. We still have a lot of work to do. We still have a long ways to go to see people be geriatric CF patients. And the work is not over. It will never be over. But we ask you to just come and check it out. Come and see what we do. And just learn a little bit about cystic fibrosis and the families and the foundation. And you'll have a friend for life.
Piper, what would you say to any other kids out there with cystic fibrosis, or what would you say to kids maybe that are younger than you that are growing up with cystic fibrosis at this point?
I would say that it's a crappy situation, but it is what it is, and you can always make it positive and just do what you can that makes you happy while you're in this situation. It's been really cool to watch the Piper's Angels Foundation in the crossing grow since I was like really little, and feels really good to know that we're helping other people, and especially kids just like me. And it's just nice to know that I have so many people that would be there for me, and just being able to show people videos, and it makes it easier to show that it's not just a curse and that it's also a gift, and so many things good can come out of it.
So you don't get a break from it, just like people who live with diabetes. You don't get a break from it. You live it every day. And, you know, she's been the face of Piper's Angel with a lot of pressure for a long time, and she doesn't get a break from that. But you've been a beautiful inspiration to so many. So thank you for that.
Thank you to Piper.
Yeah.
A lot of courage.
A lot of strength and courage. Lots of strength and courage. Yeah. What an honor.
When are you going to paddle across the ocean?
Not sure.
You know, on behalf of our family, the Piper's Angels Foundation, the Crossing for Cystic Fibrosis community, myself, I want to acknowledge and say thank you and express my infinite gratitude for the thousands and thousands of families for the last however many thousands of years. The infants that were born that died and nobody knew why. The parents and the mothers who lost their children and they didn't know why. They discovered cystic fibrosis in the last 70 years. The gene wasn't identified until the late 80s. Children were dying from this disease in the 70s, before 5 years old. All of those families who stepped up to fundraise, to create awareness, to create the Cystic Fibrosis Foundation, to do the drug research and create the therapies that we have, thank you. Thank you to their legacy, their families that live on. Thank you to every CF patient who did a clinical trial and was that guinea pig and put themselves out there for helping pave the way for the drug therapies like Trikafta that Piper's on. Thank you to all of the social services and the health workers at every CF clinic. The nurses, the doctors, the respiratory therapists, the physical therapists, the administrators, the nurses, to everybody who has made a contribution in some way, the social workers. Thank you to all of the transplant patients who have really gone through one of the most tremendous things that you can go through with CF, and opening yourself up and taking on the lungs of somebody else. And to those families and those people who were donors, because without those donors, without those lungs, those people with CF who have had lung transplants wouldn't be here. And thank you to every single person who has participated in any fundraising event ever for cystic fibrosis. To all the people out there who have walked, who have ran, who have cycled, who have paddled, who have showed up, advocated, to all the friends and family of people with CF who have stood in their corner, to all of the employees and the staff at the Cystic Fibrosis Foundation National, and to everybody who has had a contribution in our lives, to the Piper's Angels Foundation, to the Crossing for Cystic Fibrosis. We're going to keep paddling across the ocean to support CF. It was really important that we sit down and share our CF story with you, because this is what inspires, this is what creates engagement and curiosity, this is what educates, this is our form of advocacy, this is our way of showing up, and we invite you to look at the opportunities in your life to show up for those that you love as well.